Researchers wish to evaluate if a drug is effective in reducing blood cholesterol levels. A group of patients have their serum total cholesterol levels measured before initiating treatment and again after 12 weeks. The results are as shown below. And you get this table where they show you 10 patients and they have the cholesterol levels measured before and after treatment. Which of the following statistical tests would be best method to determine if the drug is effective in reducing total cholesterol levels? Choice A, ANOVA. Choice B, chi-square test. Choice C, Wilcoxon signed rank test. Choice D, independent or unpaired t-test. Choice E, paired t-test. Or choice F, Pearson correlation coefficient. I'll give you 5 seconds and I'll start talking about this question. Now, for questions like this, all you really need to do is that you need to read the last line where it asks you, okay, what's the best test for me to do in this statistical analysis? And then you look at what they provide you, like either the experiment design or in this case, they give you a table. You don't need to go and read what the table's contents are. You just need to understand that the table has numerical continuous data. And we can also identify that the data here is paired because they measure within the same patient before and after a treatment. In other words, the data points in the before and after are dependent. And with those in mind, it's pretty straightforward. You would pick paired t-tests, choice E for this one. The ones that USMLE really likes to test you on is that they really want you to know the difference between chi-squared and t-test. That's probably the most fundamental thing they like testing about. A chi-squared test is used for categorical data and not numerical continuous data. So taking this question, for example, instead of giving you a table of the cholesterol levels before and after treatment, what I could instead is give you an experiment where I had 2 different drugs and I told you the number of patients in both groups that had their cholesterol reduced. And then to compare those 2 ratios, you could use the chi-square test. Because in that case, the outcomes are categorical, right? Because you either have reduced cholesterol or you don't. It's not a continuous variable. Now, one of the other things I had on this question is that I have choice D here, independent unpaired t-test. As the name implies, that would be for an experiment where the 2 groups are unrelated. So because in this question, it measures the same person before and after taking a treatment, that's why I use the paired t-test, because the 2 values are dependent on each other. If instead I had 2 drugs, drug A and drug B, and I had those cholesterol levels, then you could use an independent t-test because the 2 groups are unrelated. So looking at some of these other answer choices here, choice A, ANOVA, that's where you compare means across 3 or more groups. So if you ever see a question where there's at least 3 groups, then you can start thinking about ANOVA, but it doesn't happen that often on USMLE. I'll come back to choice C in a second. I'll first go to choice F, Pearson correlation coefficient. The Pearson correlation coefficient is mostly to measure a linear association. Basically, you're comparing 2 sets of values and seeing if they have kind of a positive or negative correlation with each other. For the purpose of this question, it's basically a distractor. Now let's come back to choice C, Wilcoxon signed rank test. Now I put this here basically to be a jerk because I don't think they're ever going to ask you about this on USMLE. So you technically can use this when you're comparing 2 means, but usually it means you're not assuming normality in the data, which, I mean, that situation is almost never going to come out on USMLE, and I don't think they expect anybody to know what a Wilcoxon signed rank test is, at least not for step exam. Anyway, just to bottom line it again, you definitely want to know the difference between when to use a t-test and when to use a chi-square test. When you have numerical continuous data, you use a paired t-test. And when you have categorical data, you use a chi-square test. That's it. It's very simple. I hope you enjoyed this video. I'll see you in the next one.